Hi everyone, my name is Lucy Jackson and I'm a PhD student at the University of Bristol. And today I'm presenting some research titled Using Retrieval-Induced Forgetting to Understand Educator Bias Towards Autism and Pathological Demand Avoidance. So for those unfamiliar with the term, educator bias is a conscious or unconscious pattern of cognition, decision making and behaviour that leads to unequal and unjust treatment of specific individuals or groups within education. So, to understand educator bias, we considered pathways to cognitive bias through the retrieval and forgetting of personality traits of children with autism and pathological demand avoidance, which I'll refer to now as PDA. So, we modified the retrieval induced forgetting paradigm to elicit retrieval of valence traits of two fictional children. So one was an autistic child and one was a child with PDA. Participants read two pen portraits to prime stereotypes of autism and PDA, and then participants encoded 5 positive and 5 negative traits of each child. Following this, our educators were then split into 2 groups where they practiced the positive traits for one of the target children before undergoing the final test phase where they recalled all 20 traits. Memory conditions at the test phase included the practiced positive traits and the unpracticed negative traits of the target children, and then baseline positive and baseline negative, which were the traits of the unpracticed child. 50 educators were recruited for this study through mainstream and special schools. So in this paradigm, we expect to see a retrieval-induced forgetting effect where the unpracticed but related items, so in this case the negative traits, are forgotten due to the retrieval of the related practice items, so in this case the positive traits. So typically we would expect to see forgetting as a consequence of retrieval. So when we view the results and we look at the line graph, we can see that for the child with PDA, the unpracticed traits referred to as RP minus on the graph are forgotten as a consequence of retrieval when compared to baseline, which is what we'd expect to see in this paradigm. However, for the autism target child, the negative traits seem to be facilitated by retrieval practice. So our results show educators recall and retain negative traits of autistic children, which is consistent with integrated stereotype information. However, educators stated they had less knowledge of PDA as a specific diagnosis, and stereotypes for that reason were perhaps less well integrated, leading to typical retrieval-induced forgetting effects for negative traits of the PDA child.